Everyone, how are you? My name is Roham. I'm a part of MD Help Tech. Thank you for joining the webinar. Today's webinar is about exactly who we are. And with me to discuss about it is Mr. Stephen Williams. Mr. Williams, how are you?
I'm doing good. Thank you very much for asking. What about you?
I'm doing well. I'm doing well. Good to hear. Now, Stephen, so a lot of doctors, before they sign, they don't exactly know what MD Help Tech is. So if you were to describe MD Help Tech, how would you describe MD Help Tech and how it works?
Sure. Thank you very much. So, MD Health Tech is a BPO company, business process outsourcing company. We are a Chicago based company based in Illinois. So, what we actually do, we work in different domains of a clinic or the large organization, even in the hospitals as well. What we do, we work on their front end side, which includes the front desk scheduling for the patients, like appointment scheduling, rescheduling, cancellation of the appointments, follow up of the appointments, or if there is any particular query that the patient is asking over the phone that needs an urgent attention from the doctor or the medical assistant. So obviously we do coordinate between office and the patient just to make sure that their issue or their concern is resolved. Apart from that, we also work on the back end of the clinic as well, which includes authorizations, referrals, medication authorizations, eligibility and benefits verification of the patients, and even though we are also working on the CCM chronic care management side and also the RPM remote patient monitoring side of the clinic.
So we are sort of like a medical optimization firm. What we do is try to help out practices to the full capability.
Definitely.
Now, when a doctor first signs, how quickly can a practice start seeing results after partnering with us?
Well, I won't say that it much take a long time or it will take a long time because obviously the in-house staff, what they cannot do, we can do much more efficiently. So what I mean to say over here is that, let's say if there is a person sitting in the office and the person's job is to cater the patients physically coming into the office plus answering the phone calls. So, if there is a patient standing at the front desk, the priority will be to cater that patient first, then to answer the phone. Sometimes it happens that patients are calling the practice and the practice staff is not available to answer the phone and the call gets dropped. The call goes to the voicemail part, and sometimes the office staff is unable to reach out to the patient's voicemail as well. Or if they will be reaching out, that will be the day end portion or the next day. That is a hindrance between the patient communication with the office, with the doctor side, and from the patient side as well. So when we step in, things get optimized for the clinic as well, and things run much more efficiently and much more effectively.
Hmm. And that's what we want. We want to help them run more efficient. That's the biggest part.
Definitely.
Now, obviously, there's a lot of benefits of working with MD Help Tech. But if you were to pick just a few key factors, what are the biggest benefits of working with us?
All right. So the biggest benefit of working with MD Help Tech is that you don't have to rely everything to be done in your practice on the humans. Let's say, for example, you have a person who is sitting at the front desk. Due to XYZ reason, the person takes an off on the next day. You are bound. Either the practice manager is answering the phones, because I have seen on my in in my career as well, like this thing, when the front desk staff is out or like any of the particulars are out of the office due to any health issue or any XYZ reason. So the practice manager goes into their role and does their job, which is actually compromising the role of the practice manager into the practice as well, because the practice manager has to cater a lot of things on her or his hand. So with us, we give out a dedicated resource to the doctors or to that particular position where the resource is actually required. And if the resource is off or resource is out on any of that day, so the backup resource fills up that place. In this way, the office staff is doing their own tasks effectively and efficiently, and nothing falls to the crack.
100%. And the office manager is already wearing a superhero cape. They're already doing so many different things. And if you include all of the front desk work they also have to do, they'll be swamped like no other.
Definitely, exactly.
Now, when we work with a lot of doctors, they either say that they have staff that already does all these different things, or the front desk feels threatened when joining. Now, I believe that's a really big misconception that they shouldn't feel because we're not there to take anyone's job. What we're there for is to help a practice. That's the biggest thing we want to do.
Exactly. So let's, yep, that's right. You're saying the right thing. So let's look at in this portion, because taking someone's job or make threatening the front desk that their job will be taken out, that's a misconception out there. Like, that's a wrong approach. Because let's look this way: if we have only one representative at the front desk, or if we have one person sitting on the back end who is doing the verification, also working on the referrals, as well also working on the authorization of a patient. A practice manager's duty is to go back and forth into the meeting and get the business or the clinic growing day by day or month by month. If the back end person, in office person, takes a day off, what will happen? Who will cover them? Who knows the clinic much more? Practice manager, because obviously the front desk person cannot go do the back end work because they are not well trained enough to perform that operation on their side. So that will be a mumble jumble.
Yeah. Now we're talking about if the front desk isn't there, but obviously we're providing real people with the virtual assistant. Now, what happens if we were to take a day off, or if our resource doesn't show up?
So whenever we onboard a clinic, we give them a primary resource who will be performing their task when they are training us. So let me actually give you a hierarchy portion where how we perform the tasks. So when a client is onboarded on MD Health Tech, and when they start training us, they train 5 people at a time:
Mhm,
the primary resource, the backup of the resource, the team lead, senior team lead, and the assistant manager. Let's say primary resource is out, backup will fill up.
mhm.
If primary resource or backup will, like, if they both will be out, which have never happened actually, if they both will be out, so the team lead will fill up. Let's say, hypothetically speaking, if all the three will be out, the senior team lead will be filling that up. So it is something, we have a layer of people that are like responsible to do the task if one person is out. So it's, we will never say to the doctors, or we have never said to the doctors, okay, so the resource is out, we cannot perform the task today.
Mhm,
The tasks have been performed with exact the same quantitative as well as the qualitative analysis that the primary resource was doing the work. It is
mhm,
not something that the resource is out. So if the backup is performing the task, sorry, sorry, if the backup is performing the task, so the quality will be decreased or the quantity will be decreased.
mhm.
No, never.
Precisely. So there's never going to be a moment where we're able to leave you without any help.
Yes.
Now we were talking about communication earlier. How do we prevent communication gaps between remote and in-house teams?
All right. So, first of all, we prefer the communication, like the in-house communication, how actually they are communicating with each other, whether they have any in-house system to do. Like, many of the people use Microsoft Teams, many of the clinics go through Slack, many of the clinics do use sometimes Skype as well on their end.
Mhm,
So whatever their in-house communication ways, we prefer that way. But
mhm,
if they say that they don't want to use their in-house communication way, or they are looking for some better options, so yes, we do use Slack as an in-house communication for us. So we do ask them to come over the Slack, and we do enable their Slack accounts, and in this way we are in back and forth communication with the clinic.
mhm. So always in contact, and nothing will ever slip through the crack.
No. And one more thing just to put over here, like we create a group. In that group, almost like 7 to 8 people are there. So that if one does not see the message, second does. If second does not see the message, so obviously nothing will fall through the crack because 8 eyes, like 2 8 are 16. So 16 eyes on one message will never leave the message unattended.
It'll never go unseen.
Yes.
Now, obviously, we work with some smaller clients. We also work with bigger clients. I want to focus on the bigger clients for a second. How can we focus on multi-location practices? How can we help them out?
So let's suppose um, let's suppose if MD Help Tech is a doctor's practice, all right, and MD Help Tech operates like the doctor operates with in MD Help Tech in different locations. Doctor has 4 or 5 locations where they actually go with. So all the staff will be accumulated in one communication system. All right, the communication system, like that communication system is the key. We will be going back and forth into the messaging part. One group will be created in which all of the staff from the doctor's office will be there for all over the 5 locations or 6 locations, or how many locations does the doctor have. And our staff will be in there. The team leads will be there, the assistant manager will be there, senior team lead will be there, backup resource will also be there. All right. So multiple locations can be, and we have like catered multiple locations across the board. Like they are many of our clients who are not operating in one state, but they are operating in 2 or 3 states as well.
Mhm,
So we have been working with them, and we have been like successfully handling their communication as well as the operational flow,
mhm.
and obviously making sure that their quality and quantity does not get compromised, even though if they are spread around the states.
100%. That's the last thing we want to do. And just to end this off, a lot of doctors are a little hesitant to join on because they don't want to go into a binding contract for multiple years and stuck with a service they don't like. And that is the beauty of us. Not our contract is not binding in at all. We do monthly contracts, so at any moment, say you don't like it, which will never happen, but say if you don't like it, you will always have access to us.
Exactly.
Awesome. Is there anything else you want to add, Stefan?
MD Help Tech is your stop shop for everything.
A one-stop shop, anything and everything you need.
Yes.
Thank you everyone for watching. I'll see you next month.
Thank you very much, Rohan. Thank you, everyone.
Thank